Good afternoon, everyone. Welcome to another segment of our Mental Health Moments. My name is Linda Gallick. I'm with Bellin Health. I'm their Health and Wellbeing consultant, and so happy that you were able to take some time and join us today. So today we are kind of in a three-part series, and this is kind of the third and final segment. We've really been digging into ACEs, which is Adverse Childhood Experiences. And we have been talking about that, of course, in a mental health capacity, but also how that connects to short-term and long-term health issues connected to ACEs. So we've had a couple previous segments kind of laying that groundwork. We talked with Troy Schreckenbach on our last segment about some community programs that are going on where people can get involved, and we're going to be continuing that discussion today with one of our Bellin healthcare providers. So I really want to welcome Kim Shefchik to the show today. So Kim is a physician's assistant, and she specifically does some of her time in our adolescent care service line. So welcome, Kim.
Thanks for having me. I'm excited to be a part of it.
Yeah, thank you so much. And as always, we have our licensed behavioral health therapist, Charles Latour, with us. Charles, what day is it? Thursday. How's your Thursday going today?
It's pretty good. So far, Thursday is a great day.
Okay, good. It's beautiful outside, for sure. So just want to start with you, Charles. Let's do a little bit of a review, both to refresh those of us that were here, and then also people are joining you today to kind of just look back a little bit on those two previous episodes, some of the information that we've shared, and some of the kind of the groundwork as far as what we've discussed already in terms of ACEs. So we'll start with you.
Yeah, so ACEs is a term used for to describe this concept of it's basically life experiences, adverse childhood experiences, sometimes called events, but it's a 10-question survey that seeks to understand what adverse or even trauma people have had in their lives. And it's led to something called trauma-informed care. It's basically for every one question you could answer yes to on that 10-question questionnaire, and the higher the number, it's almost like a dose response. The higher number you have of adverse childhood experiences, what we know in the healthcare world is the more difficulties you're likely to have, everything from increased risk of heart disease, increased risk of diabetes, increased risk of suicide, for example. So those are the things that the higher the number you have, the higher your risk is for a number of health-related issues.
And certainly, if people are interested in taking that test, you can Google it and find it pretty easily. So, Kim, I wanted to turn it over to you. So when we look at how we provide care at Bellin, and we have kind of a newer service line in that adolescent care service line that you really helped develop. And when we're looking at children and teens, what does that assessment look like when people come to Bellin, and what types of things really are you paying attention to as their provider?
Yeah, we're fortunate to have get a call. Am I still there?
Yes.
This is what happens when
I can hear you. There you are.
Yeah, a random call comes in. So I'm fortunate to be a part of a great team of passionate people who got this off the ground. Dr. Hoyman and myself primarily work together to try to figure out how can we better meet the needs that are special. Adolescents have different needs, and yet still balancing that they're not adults, and so they often come with a parent or guardian. And so our initial sit down usually is with a parent or guardian, and we talk about medical history and things. We don't necessarily delve directly into looking for ACEs then, but we always then have the parent or guardian go to the waiting room, and we spend time with the adolescent alone. And we talk about their social determinants of health. So where are they living? Where have they lived? What kind of access do they have to food and nutrition and exercise? And what are their relationships like, both with peers and with adults? Getting to a lot of the specific factors that could be contributing to an adverse childhood experience potentially, or even something that's ongoing. And we're very fortunate that we have case manager on site, on staff. So I call our case managers the hostess with the mostest, because they're all about getting patients connected with resources. And often a lot of these situations, even people who wouldn't define themselves as being in a adverse situation have been exposed to something, and often just knowing that there is support and there's access to resources in the community, which I don't always know about. As a provider, I'm in my own lane. So having someone on staff who's really knowledgeable about trauma-informed care and connecting patients and families to resources is just a phenomenal gift that we have. And they, adolescents often are in complicated families. We now have what the definition of family is not always traditional. So making sure that we meet not just our patient needs, but their family needs, because adolescents always come with some sort of family, even if it's a foster family. So we really do focus a lot in what is their base, what is the base of their house and their living situation, and what can we do to help, because that's often contributing. And again, like Charles was saying, if we can find these things upstream when they're younger, we might be able to really improve the trajectory of their health, not just mental health. Obviously, that's critical, but the data showing ACE's effect on heart disease and liver disease and diabetes. And I have seen, my primary background was in women's health, and the rates of obesity in people who experience trauma, it's incredible. And there's clearly something that changes in a person's body, not just emotionally and mentally, but physiologically.
Well, and thank you for adding that, because I think that's also helpful for an adult audience to hear too, to once again be reminded of the connection to health and well-being, and how this is all connected. And Charles always says we don't have physical health without mental health. It's all tied together. Yeah, so fascinating. So Kim, what do you look for when you're visiting with a teen, when you have that adolescent? Are there things that kind of pop out to you? I think one of the things that might be helpful for our audience is, for them that have children or children in their lives, to pay attention to some of what's going on with them. And what do you look for? What is a red flag to you that may indicate that they need some further assistance?
Yeah, I'm a parent of 2 teens, and so a lot of what I've experienced as a healthcare provider, I'm now seeing in my own kids, and it's watching for things where you never want to ignore if your kid is withdrawing from friends, withdrawing from school, withdrawing from things they used to enjoy. That's a red flag. A child who's lost a lot of weight or gained a lot of weight, a child who's starting to, you're getting concerns about substance abuse. Obviously, a lot of us have experienced or know people who have self-medicated with substances, and often it started in their early teen years with experimenting. We talk a lot about gender concerns and sexual health concerns in our teens, and trying to promote healthy relationships and healthy bodies. But also, if we have a child who's really changing in how they're approaching their sexuality or their relationships, that could also be a sign that there's something serious going on. And I think, looking at their sleep, we all know teenagers sleep and they need a lot of sleep, But if they're really sleeping a lot more than usual, it's a big change, or not sleeping at all. That can be a red flag. So kind of looking at their basics, what are they eating? What are they drinking? Are they sleeping? And patterns with their friends. I think, having relationships with adults is hard when you're a teen, right? We remember that. So they may not be as vocal with their parents or their family members, but are they still interacting with their peers? Are they still getting together in whatever ways they now get together? They might not always get together in person, but online, are they interacting with their peers in a way that still feels that they're making connections?
Yeah. Great advice. And I think, you mentioned some things, too, that we may not always think of, like, yes, teens need a lot of sleep, but, when is it too much, or are they not sleeping enough? Charles, did you want to add on to what Kim has mentioned so far and other things to kind of pay attention to or look for?
I do, but I'd actually, if I can, just take a couple minutes to back up, and I want to connect some dots of the ACEs to what Kim is saying the result is, because sometimes what I find is people, it's really hard to think, okay, this happened and this is what it results in, and knowing kind of the pathway that someone with any number, but 4 and more is usually, once you get past 4, it seems to be the more complicated. So let's take Jill Smith or Jim Smith, and we take stress in general. So if we think, even from a baseline standpoint, stress happens in life, right? We have good stress. It's technically called eustress. We have eustress, which is, okay, you have a test tomorrow, right? You better study, right? This gets us activated, kind of good stress. Then we have what we would call either reasonable or tolerable. You're going to have it no matter what. We have losses in life, difficulties in life. We experience it. Maybe it's a loss of grandma, grandpa. We talk to maybe our mom and dad, our friends about it. They're going through it too. And we talk, we understand, we learn to learn and live with it, deal with it. We have support, right? Then there's toxic stress, right? Big T trauma, little t trauma, ongoing toxic stress. And if you think of the ACEs, it's made up of abuse, neglect, make up half of the ACEs questions. The other half is basically made up of what we would think of as household dysfunction. What's going on in our lives, those day-to-day little T's that over time make a difference. These are the toxic stress things. And in toxic stress, we have a fight or flight, predisposed biological predisposition to one or the other, right? So why does toxic stress matter to Jim Smith? Is all of a sudden Jim Smith is learning life is difficult, life is dangerous. Almost every turn I make, there's danger. Every time I turn around. And the brain gets to the point that it can't distinguish between real tigers and paper tigers, because our brain has evolved to be in survival mode looking for threat, right? When people have any number of ACEs, but really 4 and more, 6 or more, they're even more inclined from an early age to see the world as a very difficult and dangerous place. And when there's that household trauma, just bear in mind that this kid now can't say, Mom, what's going on? Why is Dad hitting you? Because it might embarrass Mom. He's not going to go to Dad and say, Dad, why have you been hitting Mom? So it goes on. So unlike the middle stress that I described, this toxic stress matters because it perpetuates that flight or flight predisposition we have, right? So now let's say the brain architecture is changing because of that, right? Neurons form in a different way. We're even more prone to threat. Kid goes to JJ's now, or Jim Smith is now in grade school. Kid takes a neutral situation, a friend or somebody that he doesn't know is walking by and looking at his shoes. Looks a little bit more longer than this Jim might be comfortable with. He's now getting, what's this kid doing to me? So a neutral situation now is seen as a threat to him. So he reacts, maybe he pushes the kid, maybe he yells at the kid, says, get out of my face. And what does the teacher see? Jim overreacting to a neutral situation, pushes a kid. So what's the teacher going to do? Provide consequences. He's going to the principal. Principal then disciplines him. How do we discipline? We instill fear. So this kid who's petrified of life already in this very difficult life we're going through now gets more fear, right? And feels more withdrawn, more uncomfortable, more alone, less engaged, and more fear to deal with, right? More fight or flight. Take that into adolescence when the brain is already changing dramatically, and the brain changes we hope for are greater prefrontal cortex functioning, greater ability to think of if then this, looking to tomorrow, planning for their future. Whereas Jim Smith is just planning survival for today, reinforcing the limbic system activity of survival mode. Just get through today. Just let this happen. Hopefully don't have this happen. And as an adolescent is exhausted. And by the time this has happened, so what happens if you've been carrying around that survival mode, exhaustion, just get through the day, anything that will help me cope, I'm going to try, right? So what helps teenagers cope? Alcohol, drugs, marijuana, maybe I'll try that too. Anything to quiet down all of that worry, all of that concern of getting through the day. And then even less functioning in the what does all this mean going to college when it's just getting to today. And most of those coping strategies, whether it's food, whether it's sex, whether it's drugs, whether it's alcohol, all video games, right? These things that they turn to cope, what do they have with them? They all have this addictive quality. And these addictions then can start. And then because they've had all these struggles with the day-to-day survival, when you're in that constant survival mode, it's always triggering physiological stuff. And this is, again, where Kim comes in great, other medical professionals, because that chronic fight or flight limbic system arousal is creating this chronic inflammation within us, accelerating, which is why, let's say, heart disease later on, it starts between 3 and 10. That has already been activated at a time where it's the least thing you would want activated. So all of those things going on over time, and we're talking like a now kid 16 to 18 has maybe a cardiovascular profile of someone much older. So I want to talk about those things just to connect the dots of why what happens to us when we're 3 shows up when we're 16, 18, 25, and maybe even more at 50 and so on. Because one last thing I want to say is, because people will tell me, well, they'll outgrow that, right? No. It's like that people think like, okay, here's the deal. My kid went through all of this, teenager, but when he turns 21, Jim Smith will like trade in all of that trauma, then have an adult brain, and everything will be great. And all of this will be gone. No, it's not. It's a cumulative process, but there are things that we can do. But if we're not doing the things that Kim was talking about, finding out what happened, Not what's wrong with them, but what happened. Why is this going on? Because discipline alone only can exacerbate it, just like the kid in first grade. The discipline didn't make it better, it made the kid feel more alone. So, how do we work with it? And those are the connecting of the dots processes of why ACEs and the earlier, the more difficult. But the earlier we could intervene, the less cumulative effect it might have. So, that's the connecting of the dots.
And Charles, I wanted to quote you when we were planning this session. One thing that you had said that I wrote down that I really wanted to make sure everybody hears is the idea of you can't out-discipline pain and trauma. That doesn't do it. And I wrote that down because that really struck me. And even now with you saying the idea of, things happening and causing inflammation at a young age that is even leading, to cardiovascular issues down the road. And we've heard that before when we had that TED Talk that we listened to for one of our previous episodes. But that really strikes me because you think about the chronic disease that we have in this nation and how much of that is rooted in some childhood trauma that people may have experienced.
Yeah, so can I say a couple more things about that?
Sure.
Yeah, so here's what I find is, like, let's say a kid then has that experience. Jim Smith is in my office, and the parents are usually in this mindset of, we're not tough on him enough. We got to do more of this. The school isn't tough enough. And I'm telling them, I don't care how tough you are or how tough the school is. It's probably not going to help it. ACEs doesn't respond. The trauma doesn't really respond to more toughness and more fear. It's like throwing gasoline on the fear fire that's already there. Do we need more gasoline on a fear fire? No. The things that help ACEs that we know of is stronger connection, greater understanding, greater trust. In fact, if there's one thing we know of more than anything else, is that the stronger a connection with an adult person in their lives, the greater they're going to deal with the ACEs they've experienced. It isn't about toughness, and it isn't about out-disciplining this. In fact, my assertion is that you can't. You have to understand, you have to connect, you have to support. They're used to being afraid, right? They're just like, okay, this is just one more thing I have to fear. But what they're craving and what that brain needs is, if there's anything we know that it's a buffer against ACEs, it's the ability to have strong connections. And one last thing I'll say is why that's so important is, in the world of connections, when I've seen people deal most effectively, it's when they almost connect with someone else who's been through some. Oh my God, I thought I was the only one, but now you, and now you, and now we almost have this almost immediate bond of connection, and I start to feel better. More fear only activates more limbic system, fear and arousal, fight or flight activity. Connection, healthy connection is what creates stability of mood, greater ability for self-regulation, and that's what behaviorally and emotionally, and that's what's going to help this student thrive rather than out-discipline. So back to what I said, you can never out-discipline ACEs. You have to connect and help through ACEs.
Kim, did you want to add to that or comment on anything that Charles shared?
No, I mean, I wholeheartedly agree with everything he said. It's interesting, though, too, like culturally in our society, there's a lot throwing around words like, oh, that was very traumatic to me, or I'm dealing with a lot of stress right now. And like the level of trauma that a person can go through obviously can vary widely, but I don't think we can ever lose sight of how traumatic some people's lives have been. And I think surveys like the ACEs survey are really valuable. I also think another point he made, which I feel has been a really good reminder, you know, a lot of teens are, you know, watching TikToks and learning about a lot of things that way. And one thing that my teens have mentioned is that stress is everywhere. And I think we also have to re-educate our youth that, like, not all stress is bad. You should feel stressed when you didn't study for a test, and that's because you didn't study. And you should feel stressed when you're about to go on your first date, or you're not sure what you're going to encounter when you start a new job. And so, you know, we have the two extremes where we have people that are truly dealing with incredibly traumatic childhood experiences, and then we have, you know, I'm stressed out because I'm overscheduled and I haven't studied for the right things in the right way. And so I think as a parent, it can be really hard because we sometimes forget that we have to remind our kids that not all stress is bad and not all things are truly traumatic, although they can feel traumatic.
Yeah, and I think that's, you know, that's one of the questions I have too, because how do we know the difference, right? Because I remember when I was a teenager and I was moody and I was, you know, I was maybe slightly difficult to deal with at times. I mean, don't ask my parents, right? But how, you know, how do we, what's that line? What's that line of, oh, she's, you know, she's being a teenager right now and she's got hormones or, you know, whatever's going on, versus, hey, there's really something going on here and we need to really dive deeper into this. And I'd love to hear from both of you on that, what your thoughts are.
Kim, you want to go first?
I think I go back to how is it impacting their ability to do the things they need to do? Are they missing out on school? Are they missing out on, you know, a job that they were committed to? Are they quitting things they used to enjoy? That would be a red flag for me. If a child is whatever their stress is, how is it affecting them? What are the ramifications on them physically, emotionally, mentally? And that would kind of help me decide, is this, and how are they coping with it? Are they using a healthy coping mechanism would be another important key for me.
Mm-hmm. Oh, Charles, you're still muted. There we go.
So I think that what I blend in with what Kim has highlighted is this, you know, everybody reacts to trauma a little bit differently. I've previously talked about even people in Vietnam and other highly stressful situations. Why do some people walk away from it with little or no trauma? Why are other people perpetually traumatized by it? A chronic traumatic response. We're all wired a little bit differently. What might be traumatic for some person might not be all that traumatic for someone else. And it almost takes me to, and again, what Kim said is the effect. What are the ramifications, the effect on school, work, relationships, whatever else is happening? We have to approach it from that way. But I want to blend in with that. And interesting, if anybody's so interested, you take the idea of what someone's doing, and sometimes it isn't even that trauma, but something behind it. So an example is recently, you know, someone has asked, you know, why did you do that, right? I don't know why. Well, did anything happen in your life? Well, my mom left us without telling us that she would be gone, and she never came back, right? So it might not be the trauma that is the little t in front, but a bigger T trauma even behind it. And sometimes it's asking some of the questions along the way. So something that seems like not a big deal, when you find out there's more to it than just what was that little thing that someone seemed like they were reacting strongly to. Well, it wasn't just that, it was really this other thing. This is just where and how it showed up. So a lot of times it's in the understanding of it, the discussion of it. But there's one other thing I want to say, if I can, and why all of this is so important. Even that how we deal with them. Trauma has a hereditary component. Like, let's say an adult who has a child and they had 4 or more ACEs in their lives, the adult, the hereditary component is especially undealt with. This child is growing up before a life event even happened with an ACE score of 4, and they don't even know it yet. So we have to get better at all of this so that it isn't just for us, it's generations to come, because ACEs have a generational component, and that in part is why this is so important. And if we don't deal with and help the hurt, we also not only pass it on from a generational standpoint, we increase the hurt as we go along, because hurt people hurt people. You know, the more hurt people are out there, the more hurt is going to happen. So we have to do better with this as we go forward, both for what lies ahead in terms of people's lives who've experienced trauma, but also for those to come behind them. That is, again, why we're devoting 3 sessions to this, and why it's so critical that not only can we do better, we have to do better.
I do want to give the audience an opportunity to ask some questions of the 2 of you, so feel free to type those in. Kim, there is a question for you. The question is, what do you consider a healthy coping mechanism?
Well, is that a personal question of what my coping mechanisms are? I actually have someone gave it to me as a bumper sticker once, but I don't actually have it on my vehicle, but I have it on my mirror in my bedroom. And it just says running is therapy, because for me, I discovered a long time ago that when I run, I just go into this, I don't know, total just brain focus. I mean, for me, it's a mindfulness exercise. So I'm a huge fan of exploring mindfulness and what that means for a person. I think being in a moment and paying attention to something that really focuses your mind and relaxes your mind. So for me, it's exercise. But I also love music. I think music can be a very healthy coping mechanism, whether it's listening to music that brings your mind to a different place, or making music, making noise, doing something that helps you release that tension and that feeling. Breathing exercises, a lot of good studies on various forms of breathing exercises. I think that everybody's different. We can get into trouble when we start coping by eating our feelings. As one of my good friends always said, I'm eating my feelings today. And definitely the slippery slope of substance abuse, definitely unhealthy. But everybody's different. I think you have to figure out what helps you feel more calm and connected, and then practicing those. You know, mindfulness doesn't always work, but until you put in the time and you really engage with your body and your mind in a way that you can really explore. Getting a really good therapist, someone like Charles, someone like, there's so many good opportunities. I mean, mental health does matter, and it is physical health. And I think, I wish we came out of the womb just connected to a therapist. Like, here's your social security number and here's your therapist number.
I agree. That'd be amazing.
I'd be willing to increase my tax rate for that. All need it, and we would all benefit, because we all need, like Charles was saying, a trusted relationship with an adult is often a huge predictor of good outcomes with mental health, physical health. You need to have somebody, and it can't always be a parent. So that's kind of me rambling on for different healthy coping mechanisms. But from personal experience, I really know that for me, movement and music, those are my 2 big ones that I encourage to do. Arts, we have lots of tools in our clinic, at the Adolescent Clinic. We have different things they can draw. We have some boards they can use to write on. We have little fidget things, different things to just physically move their body to help their brain.
And I just love that Bellin has this specific service line, for our adolescents, because they are different. They are different, and they do need different care, and they are interested in different things. And teenagers today are not like teenagers when I was a teenager. It's a different world for sure. So I just love that we have that specialized care. So thank you, Kim, for providing that care to our population. So incredibly important. So again, if you have questions for Kim or Charles, please put those in the chat. We have a little bit of time yet, but while people are putting their final questions in there, I'll just kind of start to wrap us up a little bit here. So as we kind of reflect upon really what we've covered in these 3 sessions, just a lot of great content. So if you haven't been with us for the other 2 segments, feel free to go back and look at those videos, or you can find them via podcast as well. So just search Spotify or Apple Podcasts, and you can listen to our previous episodes and other content as well. Lots of great stuff out there from the time that we've been doing these. So as we kind of wrap up, kind of some parting thoughts. So Charles, I will start with you.
Yeah, a couple. First, Kim, I want to thank you for joining us today and the great information you shared, the great content, both what you do clinically, but I love even more what you're saying that you do for yourself. Awesome coping strategies. And I'm more than you might even know, thrilled about your comments about coming out of the womb with a therapist. People have told me over time is like, why didn't I do this before? How come I never did? Why is this not something we have to do? So I appreciate your nod and support in the mental health world and the connection you're making that this is all one rather than we're health from the neck down rather than the neck up. So thank you for that. From an ACEs standpoint, one thing we didn't get to too much today, but I do want to say is that some of the information, especially some great authors on this, are saying that the better we can do from 0 to 1 year old, where more brain activity is happening than maybe more in 1 year than all of the rest of our lives, that if we can get better at educating parents, better at supporting parents, better at giving parents more resources to be able to do as great as they can do in that first year, we would be doing a lot of upstream work that isn't being done right now, because nothing is more formative. Everything else, if that 1 year is the foundation, everything else is the rest of the house. The better we could do with that, the better we will all be, not only these individuals, but from a societal standpoint. And then along the way, and I want to emphasize something that we did maybe a little bit more in the first session. Way, way too often I find that people feel that these ACEs is a zip code issue. Well, that's what happened to those people in that zip code. But coming back full circle, the first real eye-opening, turned everything on its head study was by middle class and above, hardworking people that had these ACEs. If we all took a score, we'd probably be surprised how many might have 4 or more. So this isn't a zip code issue. This is a national issue. And from an epidemiological perspective, it is important for all of us to be on board at helping us do better with what we're doing with them. So that would be what I would say.
Yeah, thank you for that, Charles. I think that's a really important reminder that this is everywhere. This is in our backyard. This is the house next door. This is potentially in our own homes. It isn't somebody else's problem. It's our population's problem. And that's part of why I'm so glad to have the 2 of you in our healthcare system working towards better outcomes in that way. Kim, what are your parting thoughts today? What else do you want to share today?
I'm just excited that there's people having this conversation, that people are asking questions about how does this affect me and my family, and that we as a society are starting to understand the generational impacts that this can have, but yet also on a positive standpoint, how we can make a difference. And like Charles said, really infants and new parents and getting the help to people early in their lives, making a difference at our well visits for our kiddos. You know, our pediatricians and family doctors do a fantastic job, and they're really looking at all of those formative years as super critical. And the fact that people are willing to listen to this, us talk today about really mental health and adverse childhood experiences is a great sign that people care and they are looking for ways that they can not just help themselves, but help other people. I'm excited.
Absolutely, absolutely. And one of the best gifts of this series is just that we're having those conversations. We're bringing awareness to everyone that's listening and watching after and all of those things. So, well, thank you to the both of you. What a great conversation today. I really appreciate your time. Kim, thanks for taking some time away from your patients. Charles as well, joining us and giving us that time to really help us learn more about these issues. So we appreciate it. I don't see any other questions in the chat, so we'll wrap up for today. Our next segment is actually going to be Thursday, August 17th at 1 p.m. So we're hoping you can join us then or catch us after with the recording. So thanks for joining us today, and have a great rest of the day, everyone.
Thank you.
Thank you.